Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Fibromyalgia is more common than you'd think. It's a chronic pain condition, and it could be quite terrible for people. When I started out in pharmacy in the 1970s, they came out with a new diagnosis called fibromyalgia soon thereafter. And a lot of people suffering with fibromyalgia were women, and they were treated very poorly by the medical establishment. The medical establishment treated them like they were mentally deficient, or they were just totally neurotic, or they were actually hypochondriacs and just coming up with the pain. So in other words, they were saying it was all in their mind. And in a strange way, fibromyalgia is in the brain, but it's not in a way that you'd need a psychiatrist or psychiatric type of medications. So fibromyalgia is probably the most common chronic pain syndrome. And you can have sometimes pain in specific areas, or it might be more generalized. It's an aching pain. The estimate is over 5 million Americans are suffering with fibromyalgia. The lion's share of these people are women. So they can have muscle stiffness and pain. They can even have pain in their ligaments and tendons and stiffness. Ligaments connect your bones, and tendons connect your muscles to your bones. So the pain can affect them anywhere in the body. And if you speak to someone with fibromyalgia, it's weird. Sometimes really minor things can set off their pain. Like I've had clients come in, if it was a strong breeze, it could hurt their face, or if it was a strong odor like a perfume, it could trigger their symptoms. This is not unique. This is not unusual. So they have these sensitivities to noise, to strong odors, to even certain foods and flashing lights and bright lights and things like this. And that affects quite a few people with fibromyalgia, that such minor things can set off their symptoms. And the pain is often described as like an aching, deep pain in the muscles. It could feel like a sharp throbbing pain or a burning pain. And these people are fatigued. I mean, they're just drained of energy, which you would expect. Anybody who's chronically in pain, it's exhausting for a number of reasons. But it also affects their ability to have a conversation or to focus on things, their attention span, because they're exhausted. They really are. Sleep, not too good. They have sleep problems. It's just they're still tired in the morning. In fact, they could be exhausted when they wake up. Their sleep is not deep. It's not refreshing. And also, many of these people also experience headaches, like tension headaches and migraines. A lot of them have intestinal symptoms, like you might call it irritable bowel syndrome. Like up to 70% of them can have irritable bowel syndrome, where they have constipation and diarrhea and stomach cramps, abdominal pain and gassiness and bloating. So welcome to our episode, Fibromyalgia, What to Do for the Pain. My name is Jerry Hickey. I'm a pharmacist who also has studied nutrition. I'm over here at Invite Health, and I'm also the scientific director. And I'd like to talk to you today about mechanically what messengers in the body are involved with fibromyalgia type pain, and what can you do about it? What can you do about it with lifestyle? What can you do about it with supplements? Please subscribe to our podcast, and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So let's get going. So, I mean, the typical symptoms of fibromyalgia are pain and fatigue and problems with sleep and weird sensitivities like to light and odors and noise and headaches and irritable bowel. But there's other symptoms. Like you could feel dizzy and lightheaded. That's actually quite common. You can have jaw pain, tingling sensations. We call that paresthesias, like pins and needles. Numbness, memory problems, cognitive problems, trouble figuring things out. I mean, there's a lot of other pains like pelvic pains. They can have restless leg syndrome where they're trying to sleep at night and they have to move their leg. Otherwise, they get these vague drawing pains in their legs. They're sensitive to chemicals. They're sensitive to changes in temperature, hot and cold. Now, the symptoms can vary. They could be very intense. They could be very mild. They wax and they wane. I mean, it's a very tough kind of condition to deal with. It's a very tough condition to deal with. So it seems to be imbalances in the nervous system, in the central nervous system. And that's why I said it could be in the head. But it's not like made up. It's real. What's happening is your nervous system is amplifying a normal sensation. So even picking up a cup of coffee or a hammer can make you feel pain. Now, what they find is frequently patients have higher levels of something called substance P. Substance P does a lot of things in the body. It's involved with circulation, etc. But it also is involved with sending pain signals to your brain. So your substance P is at the end of certain nerves that sense pain. Not all nerves sense pain. And when it's released, it amplifies the pain signal to the brain. And in people with fibromyalgia, they get this super amplified sense of pain. But also they're low in two neurotransmitters. They're low in serotonin and norepinephrine. And serotonin and norepinephrine help control pain. So that's one reason why, as a drug, they'll give drugs like amitriptyline, which is a tricyclic antidepressant, because it'll raise things like norepinephrine and serotonin, and that helps these people deal with pain. But I'm going to tell you some natural things, whether you're taking drugs for your fibromyalgia or not. I'm going to tell you some natural things you can do. I'm going to give you some evidence also that I use quite successfully in people with fibromyalgia. So one thing you want is curcumin. Curcumin. At the end of your nerves, there's a neurotransmitter called substance P. It stimulates the pain receptors in your body. Now, this is not regular pain, by the way. This is a more specific type of pain. It's called nociplastic pain. So let's talk about, there's different types of pain. For instance, most people are familiar with neuropathic pain. That's the pain you get from nerve pain. Like sometimes different chemotherapeutic drugs like carboplatin and cisplatin or taxotere used for treating cancers like ovarian cancer can cause nerve damage. That's neuropathic pain. Or you see this kind of pain in diabetics. All that sugar and inflammation is damaging their nerve endings. They have neuropathic pain. Or you see it in people who've had shingles. When they were young, they had chickenpox, and it's called varicella zoster. And later on, it comes back in later life when the immune system is sort of suppressed as shingles, and they have a lot of nerve pain. They can have a lot of them have residual nerve pain. So that's neuropathic pain. We're not talking about that. And then there's nociceptive pain, which is probably the most common pain. That's when you have an arthritic joint, or that's when you break a bone, or that's when you have pain in an organ. That's nociceptive pain. This is nociplastic pain. It's a type of pain where there's no real cause for it. Things are causing this pain that really shouldn't, like a strong breeze, or like I said, picking up a hammer or a coffee cup. So the pain signals are distorted. So you have to look at things that help this kind of pain. And one of the things that they find elevated commonly in people with nociplastic pain, the pain in fibromyalgia, is substance P, and curcumin. Well, curcumin's actually just part of the plant. It's the turmeric plant. Turmeric gives that characteristic color and flavor to curry. It's that yellowish brownish pigment. I love it. I love the taste of curry. I wouldn't mind putting it in my coffee in the morning, to be honest with you. But I love it in things like eggs. Oh, I love it in chicken salad with some raisins. Oh, it's delicious. But in any event, the major herb in there is turmeric. And turmeric has like over 150 different ingredients. One of them is curcumin. It's about 3 to 5% of the plant, but it's the best known ingredient. But there's a whole bunch of ingredients in turmeric that are great for pain. Like there's aromatic turmerone, which is an essential oil. There's bismethoxycurcumin, which is a flavonoid, a polyphenolic flavonoid. These things are great for pain, and they have been shown in human clinical trials to reduce substance P release at the nerve endings. And I've tried well-absorbed curcumins. Like we have a curcumin complex. It's the whole plant. It's the whole root of the turmeric plant, but we call it curcumin complex, where we add it to black pepper, the bioperine. It's absorbed really well. That's helped people with fibromyalgia. Then we mix another one called biocurcumin, where they take the ingredients and they micronize it into a smaller size and make it much more water soluble. And we marry that with boswellia, which is also called frankincense. That was great for fibromyalgia pain, the stiffness, the pain, the suffering. So now they're thinking that fibromyalgia is really an autoimmune type of problem. There's a study from the University of Liverpool, that's in England, and the Karolinska Institute, which is in Stockholm, Sweden, and King's College in London. And they found that antibodies are involved with the pain sensation in fibromyalgia. It's a recent study in the Journal of Clinical Investigation. So antibodies can cause, or at least can strongly contribute in a major way, to the pain syndrome called fibromyalgia. So that's very interesting, because that will give you more access to thoughts of what can really help treat the pain of fibromyalgia. So they found that the antibodies these people are releasing, they increase your sensitivity to pain, they make you stiff, they cause muscle weakness, and they also affect the nerve fibers in the skin. All of these are typical of fibromyalgia syndrome. These are all typical. And they could all be a consequence of antibodies, and these antibodies somehow are related, I don't know, to substance P, to low serotonin, to low norepinephrine. They're also finding that these people are commonly low in the mineral magnesium and vitamin D, which seem to help patients with fibromyalgia. Both magnesium and vitamin D are helpful with fibromyalgia. So let's get into some of that research. This was a review in the journal Nutrients that just came out recently, looking at fibromyalgia and what supplements might help. And there's evidence that magnesium and vitamin D are helpful. So let's read what they say in this review in the journal Nutrients. Journal Nutrients is a pretty darn good journal. Vitamin D was one of the most important nutrients in this regard. 40% of fibromyalgia sufferers are vitamin D deficient, and a placebo-controlled study with 90 subjects, they're mostly women, using a high dose of vitamin D found significant reductions in the symptoms versus the people on placebo, like pain. Now, similarly, magnesium shows a lot of promise. Magnesium's involved with pain control. Low magnesium levels are connected to more pain in people with fibromyalgia. So let's look at specific studies.